I want to get one more question in because I want to be respectful for everyone's time, and we promise to get everyone out on time. This is an issue that's always interesting to me because we talk about healthcare and the expenses and Medicare, yada, yada. Every year, Americans pay over $35 billion a year out of pocket for complementary and alternative medicine, and none of that is covered by insurances. Damn them. What do you see as the role of complementary and alternative medicine going forward? Because obviously it's popular. Obviously people find it useful. At the same time, they're seeking conventional care. What do you see as the role of what is called CAM, complementary and alternative medicine, as we talk about all these changes coming up?
I think it's going to grow. People want it, as evidenced by that huge number of 35 billion. And it does have a role in the healing process. We, being a religiously sponsored organization, have believed in that connection of mind, body, spirit, and that holistic approach to healthcare, and have offered any number of complementary therapies and modalities, even to inpatients, throughout the Mercy system. I think as we look toward keeping populations healthier and out of the hospital, that complementary medicine will have a very important place because we'll be paid not by that admission or not by that ED visit, but by how well we keep this individual and this group of people healthy and out of the hospital. So I think it's going to play a much bigger role in keeping people healthy.
I think we see, not only do I think it's going to grow, but we start to see very early signs of it being integrated. So that holistic practice actually does do labs. It isn't just about the alternative medicine. There are practices that are bridging now, the traditional and the alternative. And quite honestly for me, as insurance starts to pay for it, and it has, that's the sign that it's mainstream.
I think there are potentially positive and negative elements in it. 35 billion is a big number. We spend $2 trillion on healthcare in the United States, so it's a small percentage. The complementary and alternative medicine field is very, very broad and encompasses a lot of approaches, philosophies, and practitioners. Some are becoming more mainstream, are involved in integrated health systems, are being covered by insurance plans, and to the extent that individuals adopt these as a process of assuming more responsibility for their own care, that's good. There are, unfortunately, elements of complementary and alternative medicine where practitioners are trying to sell a magical solution and saying, if you just believe this and ignore the doctors and the hospitals, this will cure you. That's not good.
Our last 4 minutes, I want to do a lightning round. We've talked about the changes we expect in our community in 2015. I specifically picked that date because in 2014 is the implementation of healthcare reform, and I'd like each of you to tell the audience very briefly what you think the top 1, 2, or 3 impacts on your organizations will be from the implementation of healthcare reform in 2014. Tom, go.
Emphasis on other elements of the system beyond and besides just the hospital. It'll be a lot of emphasis around the patient, and we'll be working with elements of healthcare within Mercy and outside of Mercy to keep patients healthier, and in a number of ways that we discussed today.
And actually keep them out of the hospital, which is a little counterintuitive from your traditional objective. It's
taken many years for me to even start saying those words, but they're starting to come out a little easier.
Okay. Maria.
I think we'll see more patients. The evolution not only through healthcare reform, but technology evolution by 2015.
And
much
expanding
more.
access.
Expanding access, personalized medicine, very specific to the patient and the whole concept of managing you as a patient. Much more penetrated relationships with our customers as we become a united entity in terms of trying to manage costs and manage care. So certainly I see growth in the number of patients we'll see. We certainly do expect a challenge on the reimbursement side, without a doubt, as we all see happening. And so expect to see a leaner organization, a smarter organization from an operations perspective, able to really control what is variable cost in our organization.
I don't have an organization. I'll pass.
I think, I'm not sure it'll really happen, number one. But number two would be, it's my hope that the big player in healthcare, which is the government, who again funds more than half, will start moving to where employers have been over the last several years, which is more prevention, more outcomes management, instead of just cost management. And as a result of that, employers will fund a lot less of healthcare.
Okay. Well, I think we've had some tremendous insights from our panel. I appreciate your sharing your expertise and time today. Thank you very much.
Well, thank you, Derek, and our distinguished group of panelists for that enlightening discussion. When we first started planning for this, we looked at the panelists and we said, you know what, these could have been 5 keynotes on their own as individuals, and for all of us to have as a group, we are just really delighted. When we first started Cincy Magazine 10 years ago, I often would come back to the office, and it was an office of one. And when I'd come to an event like this and I'd learn something, it didn't give me much gratification, because I'd come back and I'd be like, you know, a 10-year-old. I wanted to share my good grade with somebody, right? And for us now, as leading the company that we have now with Cincy, it's probably nothing more gratifying to me to see someone that has learned something within our office and then implements it. And that's probably one of the biggest feedback that we get from an event like this is there a takeaway that we can take to enable you to have some real-world deliverables? This is why we're so excited that CBTS has given us some ideas and their interest to assist with this deliverable. Now, please welcome Dan O'Brien, who is the Enterprise Solutions Senior Manager for CBTS, who will give us some more information on the virtual site and CBTS has created for the Healthcare Summit. Dan.
Thanks, Eric. I think everyone hopefully learned a lot today, and again, our intention is to share this information and hopefully have a second year, third year, fourth year of this first exciting healthcare summit. I think one of the key things that whether the industry is growing or shrinking in healthcare, we've talked about technology and the need to increase technology from all the panelists today. And again, that is one thing that CBTS specializes in. We are a full-service provider of solutions where we architect, deploy, and manage customers' business solutions. As a matter of fact, Gartner and IDC both say that 20% plus businesses by the year 2012 will no longer own their IT infrastructure. And again, we find that in our data centers and our managed services that more and more customers are deploying solutions via private or public cloud infrastructures so they can focus more on their core business of outcomes, whatever business they're in. One of our very large customers here in the city actually went from 90 days to approve and roll out new IT systems down to 15 minutes. And what's that mean? That's speed to market, improving outcomes, reducing risks, and costs all at the same time. We've invested heavily in state-of-the-art solutions and facilities, and along with our co-sponsor of Hitachi, again, bring those solutions to all small and very large businesses out there today. Again, if everyone would look on their tables, there's little business cards. We try to make it very easy, also in the pamphlet, to go to a microsite to give your feedback on today's session. It's mycbts.com, Healthcare Summit 2010. And again, we would encourage everyone to go out there. There'll be presentations out there. There'll be ways to contact and follow up with all the panelists today. And again, we're going to try to make this an interactive solution. We'll share pictures, video from today's event. All this has been videotaped that you can share that within your organization as well. To help incent you to go out and spend that 1 to 2 minutes to look at the microsite, to register your survey comments, we also have a number of gifts. and prizes that we will award to those that do that. $150 gift certificate to Jeff Ruby's restaurant, autographed copy of Magic Johnson's 32 Ways to be a Champion, complimentary leadership sessions, also 3D webcams, which make great Christmas gifts. We also have a second 3D webcam available at the CBTS booth right behind the main entrance today. So again, I just wanted to thank everyone for their time today. CBTS would love to work with many of the folks here. We actually, every one of the folks that are panelists today are some way associated with CBTS today in delivering solutions. And again, if we can help improve your outcomes and future events, we will continue to be a sponsor at these. Thank you. Back to you, Eric.
Thank you, Dan. Boy, I used to joke that when you get a Jeff Ruby gift certificate, you usually give $50 out, and that would get you a couple drinks, right? $150 will go a long way. That's great. Just to let you know that there were some questions that we saw at the end that weren't able to be discussed. So that CBTS website will carry those questions, and we'll be able to answer them there. I would like to thank the Westchester Liberty Chamber Alliance for their partnership with Cincy in making this event, I believe, a success. We appreciate the support of our panelists. Thank you very much. And our sponsors. I would, again, like to thank Humana, CBTS, the Highland Group, and ITA Audio Visual Solutions. As you walk out today, you'll be able to pick up a copy of our most recent issue of Cincy, which we think is pretty applicable because it is our Best Doctors in America issue. And be on the watch next month as we have our annual Power 100 issue, and in that will be the Healthcare Summit feature as well as photos from today's event. Thank you for coming. We look forward to see you next year.
Thank you very much.
Thank you.
Yep,
Yeah,
appreciate it.
great comments. Thank you.
Pleasure, Tom.
Thank you.
Nice job.
Hopefully it was helpful for
It
the
was.
group.
It was. Thank you.
Good.
Thank you for sharing.
Enjoyed it. Good, good.